Today's theme of discussion is mental health and COVID-19 during and post-pandemic era. And I will be talking about the coming aftermath of this pandemic from a psychosocial perspective. But the interesting question is, why are we talking about this today? As the pandemic grew over time, it has had an impact on all of our lives, in every country, in the way we are living and will continue to live. The one question that is perhaps in everybody's mind is what will be our future? Reports suggest that pandemic has had a huge impact on mental health. The rapidly evolving situation of the novel coronavirus created a lot of confusion, fear, anxiety from the very beginning. And gradually, media started to report a substantial psychological impact of both the outbreak as well as the response to it, which included, of course, the social distancing measures and lockdown. Then hospitals, they were overwhelmed with the increasing number of cases. Then media started reporting how it's increasing. There were incidences of food shortages, school closures, job losses, and a series of preventive measures. They have already affected us psychologically. So at this juncture, what seems to be becoming very prominent is that psychology or mental health has an equal role, or if I may say, a greater role to play in the coming few months than what our initial response to the pandemic was. The mental health impact can be very easily seen in those who have been infected or quarantined, or those who have lost their near ones. It can also be very easily seen in healthcare professionals, our doctors, our nurses, and service providers who are dealing with the problem right at the forefront and are trying to cope with the work pressure as well as trying to be safe themselves. But here, the question is, how is it important to know about it is very important to know about the impact it has on the vulnerable groups. So I identified 3 vulnerable groups: older adults, people with chronic conditions, and people with disability. To speak about the older adults, they are likely to feel the impact of lockdown more intensely than younger groups. Older persons, they confront multiple barriers in accessing quality health care, including affordability, accessibility, age discrimination. There was a lot of noise. Shall I continue now? Okay, great. Older persons, they had a lot of issues regarding quality healthcare, then whether it is affordable or not, whether it is accessible or not. Then they also have concerns about age discrimination and age-related stigma. So that experience also varies with the gender, their income level, as well as their racial or ethnic backgrounds. Avoiding contact is a particular concern for older adults, many of whom may be at a risk of exposure to coronavirus infection as they have to rely on direct care workers. Old persons who live alone, they face barriers to obtaining accurate information, food, medication, and other essential supplies during quarantine conditions. Similarly, older persons living in long-term care facilities, such as nursing homes or rehabilitation centers, are particularly vulnerable to adverse outcomes and infections of COVID-19. We also have to remember that often our older generation, they are the caregivers of children. For example, in Germany, there was a time when the grandparents were asked not to be the primary caretakers of small children who were still going to the schools. So it increases the risk of COVID-19 for them. And it also makes it difficult for the older generation to self quarantine themselves. In addition, the higher mobility of younger family members living under the same roof adds additional risks. And it is an extremely testing time for people with existing mental health issues because there has been a lot of disruption of services because hospitals are now overwhelmed with coronavirus cases and it is difficult for older adults to report their relapses. And they may also be particularly nervous about contracting coronavirus because of the triage policies. I remember watching television and how triage policies are discussed openly in Germany. That, for example, you are a doctor and you have two patients to attend to. One of them is an 18-year-old and the other person is an 80-year-old. And you have both of them need oxygen mask, but there is only one. Who would you treat? So these kind of questions about life and death, they make it very important concern or make it very difficult for older adults to imagine their own safety. Also, COVID-19 has reinforced the idea of older people as frail and vulnerable. So it is very likely that ageism will get worse in the post-pandemic workplace and older people will have real difficult time to find work. Now let's see what are the major risk factors here. So it has been seen that countries with a very weak public healthcare system or countries with high population density and larger older population, they are really at a risk of making their older generation vulnerable to COVID-19 as well as mental health issues. Now let's look at the other category, which is people with chronic conditions. Similar to older people, they have difficulty accessing medical care because of the hospitals are now targeting mostly just one disease. And here is an example of age-wise distribution of comorbidities among adults hospitalized with COVID-19. I could get this example from USA, which shows how hypertension and cardiovascular disease, they can be a cause of concern for older generation, while in USA, obesity is also a matter of concern for younger, for the youth. So it will definitely have an impact on their mental health. What about the disabled? So this is the third vulnerable group. And though one in every 7 person on earth is disabled, the measures to reach out to them are not really sufficient. What has been seen is that persons with disability are now 3 times more likely to experience different forms of violence than persons without disability. Then it has also been seen during COVID-19 that gender-based violence among women and girls with disability has increased due to social isolation and disrupted routines and because they cannot reach out to their own caregivers. Then COVID-19 has also shown us that persons with disability, they face discrimination and barriers to access information, education, and services. After that, what do we see about other demographic categories? What about those who do not fall in these categories or the other section of the population? How has the pandemic impacted their mental health? So, what about our children? So, initially, it was believed that uh, children were apparently untouched by the pandemic, but reports now say they are also at risk. However, the risk of mental health is even greater. Why? The problem is that there has been a risk of falling into extreme poverty. As you can see the data here, about 42 to 66 million children are now estimated to fall into poverty. Child health care is a major concern, particularly with those families who have suffered an economic setback. With school closures, a huge section of children who depended on midday meals or school meals, they cannot get that. So their parents have to now provide them with extra amenities which the school used to provide them. Apart from that, because of the conditions of the hospitals and our clinics now, there have been cases of reduced immunization, which can pose a great threat to child health. So, studies show that the infant mortality, which was kind of reverted in the last 2 to 3 years, has suddenly gone back to what it was because of the COVID-19. Let us look at another very major crisis which we all might have encountered. That is that of school closures. So the map here shows the expanse of school closures in different countries, where some of them opted for localized school closures and majority of the countries opted for countrywide school closures. Mhm. So, which has had an effect on more than 1.5 billion children and youth. But we also have to remember that not all countries can afford uh, distance learning or online learning. So the reports say that only two-thirds of the countries could introduce national distance learning. However, within those, the low-income group share is just about 30%, so which makes it very difficult for the underprivileged section to access learning or education during this entire period. So many of the students are now taking classes as well as socializing more online. And the esteemed guests today also talked about how the world has suddenly changed and we are all now dependent on our online interactions. So spending more time on visual platforms have left children really vulnerable to online exploitation and bullying, as rightly pointed out earlier. And a lack of face to face contact with friends may lead to heightened risk taking, such as sharing inappropriate content or images or a lot of other inappropriate games, perhaps. Increased and unstructured time online has exposed children to potentially harmful and violent content, as well as a greater risk of cyberbullying. So, UNICEF Chief Henrietta Fore, she rightly points out that the COVID-19 pandemic is now increasingly turning into a child rights crisis. Okay, so is COVID-19 increasing the gender gap? What about our women? Disease outbreak, history has shown that disease outbreaks have affected men and women differently. And epidemics make inequalities more prominent. And women and girls are at high risk of being the victims of a lot of uh, psychosocial and economic hazards. Um, why so? So, World Economic Forum points out that women they nearly represent 70% of the healthcare workforce globally. So that definitely makes them more exposed to coronavirus. And though they are there in such huge numbers, not enough attention is given to how their work environment may be discriminatory, as well as not enough attention is given to their psychosocial needs or their health needs, as they are the frontline health workers. There are greater incidences of violence against women. And of course, as it is known that women, they are financially less secure compared to men. So for every $1 that a man earns, women earn just 79 cents, making them financially weaker section. Added to that, women comprise greater percentage of older population, thus increasing their risk. And often women are the primary caregivers in single parent families, which increases their economic burden. After that, let us look at the other phase of this pandemic, which is about the inherent fear and discrimination. Throughout history, infectious diseases have been associated with exclusion, in-group and out-group uh, emotions like that. Disease outbreaks create a lot of fear, and this fear is the key ingredient for racism and xenophobia. During this pandemic, this has done huge damage to the people. And on top of that, there is the damage caused by the disease itself. So, attacks on East Asian people living in the US have shot up during the pandemic. Even in our country, we have witnessed that in India. New York Times published an article with the headline, India, a pandemic of prejudice and repression, referring to the segregation of specific communities and ethnicities due to fear of contamination. Now, although the expression of outright discrimination has been greatly reduced in recent decades, more subtle and chronic forms of discrimination are still very much prevalent, and particularly for certain groups of our society. Here is an example of the kind of discrimination members of a specific ethnicity had to face in US. So it ranges from verbal harassment to physical assault to being cuffed or spat on or being barred from transportation or even vandalism. So for many people, discrimination has now become an everyday reality. Often, discrimination stems from fear and misunderstanding, but we must acknowledge that discrimination is actually a very serious public health issue and also a mental health issue. Research suggests that people who say that they have been discriminated, they rate their stress levels higher than those who do not feel like that. So there was this a very interesting meta-analysis at the Department of Psychology and Neuroscience in Duke University by Pascoe and colleagues, who identified the impact of perceived discrimination on mental health. So they found that any kind of perceived direct or indirect discrimination is strongly associated with mental illness symptoms, including depression, anxiety, paranoia, or even psychosis. Perceived discrimination also leads to psychological distress and low general well being, including low self esteem, low life satisfaction, and expression of anger. Moving on, discrimination based on economic disparity becomes even more prominent during a crisis situation. So, stigmatization of certain groups, such as migrants, during crisis situation is not new. Not only in India, the migrant situation crisis is a global problem. Here, I have collected pictures from all possible continents. And from terrorism to disease outbreaks, migrants have often been scapegoated for endangering native populations. Diseases have at times been perceived as something very foreign, as was the case with cholera in 1830s, when Indians were looked down upon as a cholera spreading community. Or, for example, HIV/AIDS in the 1980s, or more recently, the H1N1 influenza. The stigmatization and discrimination of migrants during the COVID-19 pandemic are not only harmful for the migrant themselves, but also for the whole society. So, the World Health Organization rightly points out that the stigma will drive people to hide their illness in order to avoid discrimination. They might also prevent people from seeking immediate health care, and it will also prevent people or discourage them from adopting healthy behaviors. So, in the long run, we will all be at risk if we do not integrate everybody within our social structure of mental health care as well as medical health care. Okay, moving on. What about the population, or what about the section of the population that doesn't fall under the vulnerable category? I, being a work and organizational psychologist, have more interest in working with the working class and their problems of dealing or coping with the coronavirus pandemic. So, if I may take the liberty to say that the non vulnerable group is perhaps includes those who are apparently healthy within the working age range, and it includes those who must work. The fear of getting infected and locked down has completely changed our work culture overnight. What does this include? This includes either temporary or permanent job loss with reduced savings to cope with the crisis, or it can mean that there is a decrease in the working time because of the implementation of social distancing measures. So, a lot of companies, they have asked their employees to decrease their work time, which means that they will also be paid less.
Ma'am,
And
can we request you to summarize in 2 3 minutes, 5 minutes maximum?
yeah, okay, I'll do that
Yeah.
quickly. This is not going to take longer. Okay. So the other section is, of course, the section which has to continue working. There are jobs which or services which cannot be done remotely, while there are jobs which can make use of teleworking by upgrading technology, and remote working or work from home has now become a norm in this era, or the new normal. So it will be interesting to see what we learn from here and what are the issues that we might encounter in the current paradigm. Even traditional institutes like universities and colleges have switched to teleworking or work from home. A direct consequence of this has been the increase in work life conflict. Many believe that they are working more to meet the demands of their profession. But is there a gender imbalance here? Yes, there is, because the pressure is more on the women to be actively engaged in childcare, homeschooling, as well as domestic labor. Okay, so what are our survival strategies? What can we do now? The question uh, that is there in everybody's mind. What we can do here is we can include these steps in our daily living. For example, maintaining healthy lifestyle, in improving our diet or including proper diet, sleep and exercise, avoid substance abuse, smoking, alcohol use, or dependence on drug to deal with emotions should be checked. And if you feel overwhelmed, then talk to others. Make a plan to seek mental health advice or medical advice. What is very important is improve your social contact. It is very normal to feel sad, stressed, confused, scared, or angry during a crisis. So, talking to people you trust can really help. So, contact your friends, contact your family. Connecting with empathetic and understanding people will remind you that you're not alone in the midst of difficulties. What else you can do? Develop realistic goals, be proactive, try to see what's affecting you, try to reach out to your own problems. And taking initiative will remind you that you can also thrive in stressful situation. And very important is limit media consumption. Try to get the facts, be aware of infodemics, try to find a credible source of information so that you can plan your own course of action. What do you do at work? Please do not try to strive for work life balance because it doesn't really exist. You cannot balance work and life as two watertight compartments. The idea here would be to go for work life integration, where the positive effect of one aspect of your life, which is your personal life, will have a positive influence on your work. So you can try to synthesize everything very positively, your work, yourself, your community, and your family. So um, positivity from one aspect of life will spill over and create a more encouraging environment for you to work in another section. For households with children, try to be supportive and responsive to their needs. Engage with children in their activities and engage in your activities. Try to follow a routine, or when the situation changes, create a new one. And you all will agree that children now are aware of everything that's going around us, but they do not know how to find answers to their questions. So it is very important that we take the initiative and inform them in an age appropriate way. Be aware of online risks. Try to be a little more participative. How you can do that? Just make a daily meal plan with your child, or if you have a challenge at work, you can make them participate and discuss with them. They will also get a sense of autonomy through that. Encourage empathy and positive communication. That is going to make them better citizens. And when we talk about future, they are our future. So if we start the practice of encouraging empathy and positive communication, we might end up having a better society. Okay, so how does the world look after COVID-19? Horst Opachowski from Germany is a futurologist, and he is an economic and political advisor to the government of Germany. He predicts that uh, the world after COVID-19 would be a better world. How? There would be much stronger trust in fellow human beings. We will try to make our connections with our family, with neighbor even stronger. There will be more moderation and mindfulness in comparison to the earlier, uh, over enthusiastic expression of or celebration of everything and consumerism. So that will be taking a backseat, and we will more focus on mindfulness and positive ways of living. And there will be a very radical change in the way we think. What would that be? That, health is really the most important thing, and time is as valuable as money. Professor Amartya Sen, who is a Nobel laureate in economics, he takes an economic perspective and says that the world after COVID-19 will be a better society because there will be improved equality, and with improved policies, there might also be greater access to food and healthcare for everybody. And last but not the least, the Dalai Lama says that we will have a better society because we will all be united by a desire for happiness. So, in my opinion, a safer future is a happier future, and I end my talk with on that positive note. And I really thank all of you for being so patient and listening to my talk. And I hope that we can meet again when this pandemic ends, and we can discuss on the lessons that we learned from COVID-19 pandemic. Thank you very much.
Thank you so much, ma'am. For I must congratulate you for this wonderful presentation.